Okay, welcome back, folks. We are going to continue our markup of H46. And we, our vice chair has graciously agreed to take copious notes so that we can give them to Katie when she's available. Katie's right now down staffing Senate Health and Welfare on another one of our bills. They're hearing testimony on H91. In case you're interested in listening in or watching that at your leisure. And Jubilee is down there monitoring that for our committee. That's where she is. Okay. So let's talk about powers and duties. I think Dan and Doug were asking how we might best utilize a council and their purpose. And one of the things that stood out to me in thinking about an initial needs assessment is one, I think soliciting comments from the general public doesn't make any sense because we're really talking about the people who are impacted by rare diseases.
Right.
Not
general
public.
Right.
So that would be sort of one thing when we're referring to, how we might provide assistance or what the work that these folks might do. So, one of the things that I was wondering about, so the only thing that we have from the health department is making estimates of the number of people in Vermont with rare diseases based upon national incidence rates. And so, that's, estimating approximately 10% of Vermonters. So, we heard from one of the witnesses, 65,000 people in Vermont, but we don't really know if that's true. That's just sort of taking broad global. We know that there are hundreds of rare diseases. So sort of looking at that. So what do we want this group to do? What do they need? We have to kind of look through two lenses. What do we want the group to do? And what do they need the group to do? The people who are requesting this and the people who are being impacted by these rare conditions and diseases. And I think that might be two different questions. The answer to that might be different. So what are people's thoughts about that?
I have just a couple of thoughts about what I think we might like to see is there is this national resource out there. So to make sure that, maybe the notion making theories, but it seems very soft. I would like to see them engage with other state organizations or this national organization and build relationships. Yes, yeah. C1. But maybe that says it somewhere else already.
So things like, one of the things that popped up just even in listening to the testimony we just heard, thinking about what the barriers are for people. So, transportation being a barrier, consulting with other states about, where are the resources for my particular rare disease.
Especially because so much of they don't appear in Vermont.
Exactly. Here. Right. Health insurance barriers. What are the barriers in health insurance, whether it's public or private, or public and private? Those
related to that, pharmaceuticals.
Right.
And the issue of the DAs was interesting to hear that connection, the access or lack thereof to the DAs. So I thought she outlined a path forward on the needs assessment, or started to outline things that could create a path forward without it getting too bogged down into.
Yeah, give us your thoughts.
Specifics. Well, I think just sort of the list of things she talked about seemed broad enough in scope to encompass people with a variety of rare diseases, everything from the access to the DAs. I'm trying to read my handwriting. The pharma costs, insurance, just what you were outlining a moment
Yeah.
ago, transportation, case management, she talked
Case
about
management.
specifically, the Katie Beckett issues.
Yeah, that's insurance.
Yeah, resources, availability and access. So those things seem at least a starting point. And as to what could be encompassed in a needs assessment. And I don't know if you envision through H46, breaking down what elements of a needs assessment, or how much of that would we leave to the advisory council? And maybe we give general direction, a needs assessment of issues impacting the broader rare disease community. Not that that's the exact words,
Yeah.
but do we narrow it to that extent and then leave it to them? Or do we start with a list like we were just discussing and include that? I don't know the answer to that.
I think for me, like the broad areas for a needs assessment that impact kind of the community of folks that are being impacted are diagnosis, treatment, specialists, and support. Like those are, and like resources and support services. So like conducting a needs assessment on like what is available and what the gaps are around those high level areas. And I think those would be helpful to anyone experiencing a rare disease, not have to be specific to the rare disease. Like she talked about not having specialists in Vermont that were, so identifying where the gaps may be and, or, where to look. If you live in Vermont, where are the closest hubs of medical professionals that can help? And having connections and relationships with those hubs like Boston or Dartmouth, right? Or New York that are close enough to us, and establishing some of those relationships so patients don't have to like kind of build that path every time.
Will you say that again, your initial part, you talked
Yeah,
about
so
diagnosis?
include access to diagnosis, treatment, specialists, and support services.
So when one asks for a needs assessment, that sounds to me like something different than a description of what actually exists. Needs is sort of like identifying individuals' needs,
Mhm.
right? But there are a number of things that all of those things that probably exist. So it's almost like we need a survey in a way of what, but maybe that's what a needs assessment is. I just don't.
I think we can come up with a different phrase than needs assessment, because I
Yeah.
think that it does imply, or at least it tends to imply, something that's specific to individuals. And I think we're sort of a step above that in terms of systems thinking about how people access the things that, both Ray and Doug were just talking about.
For me, in this particular situation, because needs assessment, and we already know there are so many rare diseases that you could really get into the weeds pretty quickly here, trying to create a needs assessment or report. Or
So I think at the very least, we are talking about, I think everybody's agreed that we don't need this to be we're not soliciting comments or taking, making inquiries to the general public. We're really talking about people who are impacted by rare diseases. So that's, those are care providers, those are individuals themselves, those are people providing healthcare. But I mean, it's really, it's a broad array of people. So I think we'd want to change that language to, instead of from the general public to from individuals impacted by rare diseases, to assist the advisory council with that's where I get hung up.
Number 4 down below sort of speaks to some of the things we're talking about right now.
And that's specific for healthcare providers.
Yeah.
So I think that's actually kind of a different thing. I think that's a separate thing. I think that some of the things that we were talking about is actually in number 3 in terms of access, healthcare coverage, diagnostic, and screening and treatment and other services. So I'm just wondering if we kind of ditch the concept of the sort of needs assessment.
Although I like the idea of like a survey or of like people within the rare disease community, to kind of help identify some of the gaps that exist. Which, I mean, it doesn't have to be a needs assessment, but I do feel like some,
Well, maybe we could just say that to identify gaps.
the
instead,
needs
or-
of the, I mean, it doesn't have to be a needs assessment, but to assess or identify the needs and the gaps.
Of, you know what, if we take out there of caregivers, that would help clarify that we're looking at the big picture,
Of the
not
big picture.
individual people.
Yeah. So how about convene public hearings, make inquiries, solicit comments from individuals impacted by rare diseases to assist the advisory council with determining the needs of individuals with a rare disease in Vermont,
Or just with assessing the
with
needs,
assessing.
assessing the
needs gap?
needs.
Is it a needs
opposed to-
gap
That's
analysis?
what it sounds like to me, yeah.
So individuals impacted by rare diseases to assist the advisory council with.
Yeah, I don't like initial, with a, I'm just wondering if that's, too lingo-y or too.
Yeah. But I think,
I don't even know if that's a
That's a
word.
good
but-
word.
Can you define lingo?
Yeah, I know. I don't think you'll find it in the dictionary.
so I guess I would take from that needs gap analysis is gap is really the integral part, because needs, there may be things that folks need that there's
They'll identify them as.
plenty of
gaps.
resources for.
Right. Yeah,
Yeah, it seems like we're trying to figure out a way to
with
identify
an
what,
assessment of the gaps,
yeah.
impacting individuals, their caregivers and providers, individuals with a rare disease, their caregivers and providers. We already know it's about Vermont.
Gaps.
So
So I
let's,
have convened public hearings, make inquiries and solicit comments from individuals impacted by rare diseases to assist the advisory council
Mhm.
With an assessment of the gaps for individuals with rare disease in Vermont.
it is their rare diseases, their caregivers and providers. Because I'm not sure about the sentence structure. I think Katie will figure something out. But so in that first one, we're talking about, identifying the gaps.
Bringing them information that,
Yes,
that will support folks.
yeah. Okay, so let's leave the wordsmithing on that one for the moment. The second is about providing testimony and comments on pending legislation and rules that impact Vermont's rare disease, but the General Assembly and other state agencies. We've heard changes in policy on transportation, for instance, impacted people. And with that, we heard that from the witness yesterday. So that seems to be a pretty relevant one to keep. Yes? Anybody any suggestions for wordsmithing that? Let's leave it as it is so far. Yeah, or okay, go ahead, Esme.
I saw some good language. Rare disease advisory councils are enabling states to strategically identify and address barriers that prevent individuals, that prevent individuals living with rare diseases from accessing adequate and effective treatment and care for their condition.
I like that.
Number
Yeah,
one or number two?
this one is from the National Organization for Rare Disorders.
Yeah.
Said I wrote that.
With the assistance of Chat GPT. Yeah.
And maybe.
Let's figure out how to incorporate that into.
Sure.
You copied Katie on
She,
that.
Oh, yeah.
I think are you What are you doing?
Were you gonna send it to all of us or just?
Oh, I was gonna send it to all of us here for conversational purposes.
That's fine. That's fine, yeah. I just want you to,
So,
yeah,
I'll
coordinate what
incorporate
we
it
send to Katie.
into,
Okay,
okay.
Okay. So that would be in addition to, we would figure out how to figure that
Incorporate
wording in
that,
there,
yeah.
yeah. So, and then consulting with experts on rare diseases, develop policy recommendations that improve access. I don't think we really need to use, I hate using the word patient. It's like, it's a, so can we don't need to say patient, improve access to and quality of services provided by rare disease specialists, advance affordable and comprehensive healthcare. Yeah, affordable, that'd be nice for all of us. Provide relevant diagnostic services and improve programs, such as the state's newborn screening program. Ann and or Dan. I'm just wondering about state's newborn screening program. Is there, I mean, is there a reason for calling that out? Do we have evidence that it needs to be improved?
Oh, you're right.
I think it's
You're right.
talking about like it's using that as an example of the diagnostic services, not something to be improved. Because the newborn screening program is a diagnostic service that's done
It's done automatically.
automatically, so I wouldn't call that out.
Yeah, I feel
would-
that's,
Would we think of it any differently if the federal arm or federal component to that is going away? Would there be more need for the state to be looking at changes and improvements along the way if they're not getting that?
well, yeah,
But then that would be encompassed under
Diag-
provide relevant diagnostic services. We don't need to.
I think we can
like,
say
call out.
provide and improve relevant
Yeah.
diagnostic services and programs.
Or remove it, improve,
Yeah,
because it's saying, consult to get recommendations. Right, policy.
Right.
Policy recommendations that provide relevant diagnostic services and programs such as, yeah, just in the sense that it's just an example. If
Yeah,
it doesn't say improve, then we're.
or drop
okay with-
improve, yeah.
What if
Yeah.
we just include diagnostic services and screenings? And leave it at that because I don't know what screenings do or don't
Oh.
exist beyond newborns.
I think that we're dealing with the issue that you're raising, Doug, about, what if the federal stuff goes away? So We're saying consulting with experts on rare diseases. So we're saying that, well, it doesn't say consult with the CDC or, so yes, they will have to
So
seek
to
out.
take up, what about, and keep programs there, programs and screenings, or programs such as screenings. Improve programs such as screenings.
I think provide relevant. I don't even do it. I don't know if we need the relevant, provide diagnostic. Provide and improve diagnostic.
services and programs.
Well, it's not just diagnostic though. So maybe we just keep C as diagnostic and then we have a separate thing
For
that
screening.
talks about, well, we can say diagnostic and screening in that one, but then the supportive services being in a separate one. Because that really comes after the diagnostic and screening. I mean, it's not really all part of the same. Diagnostic and screening is part of the same process.
Well, what jumps in my head is what professional, because none of us are professionals, reviews this before it goes anywhere? What professional, because none of us are professionals and we're really
That's why we
making
take,
these decisions. So do you have somebody from the health department or some professional read this thoroughly and see what is relevant?
yeah, I mean,
Yeah,
so
okay.
we will, what we usually do is to, language that we're developing, we consult with the relevant in our
Parties.
state agency to assess that, yeah.
I was just
Any
curious.
feedback?
We're throwing stuff in here and none of us are professionals, nurses or doctors.
No, it's a valid point. That's why we have witnesses who have experience in this, so.
No, but I meant the final document
Yeah.
before we go for a vote or anything.
One,
Yeah, Dan.
one thing, is the list that the newborn screening, so just from the article, it talks about, some states have adopted legislation requiring newborns to be screened for any disorders on the federal panel. So in other words, the list that they screen for, I mean, wouldn't we want, this commission to look at what we're screening for? Or at least have some,
Yeah,
you know,
I think
if there's, see what we are screening for and then what other states or what we should be. Are we screening for all of the rare diseases with newborns that we should be?
so. It's not just. I feel like that's contained in the consult with experts on rare disease to develop policy recommendations. So we're talking about developing recommendations. So it's not only access to and quality of, and it's not only affordable and comprehensive healthcare coverage, but it's I can't think of the language now, and it's probably the first thing that we put up under A, but it is the content or the diseases or conditions that are screened for in the newborn screening
Yeah.
program. So I think it's a good point because we now don't have access to the federal because there isn't one. And that is what they have been using to
Decide what's in the list.
decide what's in the list. So this group, it would be a relevant thing for them to do is to make recommendations about what should be there if there's something that's not
See what
there.
we're screening for and what.
After
what we
consulting
could
with
be.
experts, right?
Yeah.
So somehow in there
So
about.
that would be in three, right? Up
It would be,
above.
it would be in
Experts.
three, it would be 3A instead of improving patient access. It would be 3A that would, is about, recommendations that, I don't know how to word it, but it's about recommendations about what conditions are screened for in the state's newborn screening program.
Mhm.
Because right now they do
Whether-
30, they do 33 screenings right now.
Oh, right.
But there could be some
Yeah, yeah.
rare disease that is found that, because we don't have access to any federal resource now,
Mhm.
that is identified that
Especially-
we may need to.
Something's coming up.
Frozen in time.
Yeah, right, the list is not gonna, it shouldn't be
Right,
frozen in
sure,
time,
right.
yeah.
Because if they're starting to see that happen in Vermont, maybe right now there's one, right? You wouldn't necessarily screen for that, but then all of a sudden, if this commission is finding that, starting to see.
Yeah.
Then we should
Mhm.
start screening, like, yeah, how do we make sure the list is not static?
Yeah, exactly.
I was intrigued when she spoke, said that in Canada, one of the
Yes.
3 diseases that she has, there's
Still there.
more occurrence of it in
Canada.
Canada.
Hence it has a French name.
Yeah,
Yeah,
yes.
I
wondered about
that. It was
There's a-
very
yeah,
interesting.
yeah, genetic markers and all that. thing.
Very interesting.
Fascinating.
It is fascinating. Okay, so I think that should be the first thing because that's kind of like that's at the very beginning.
So can we go back to the C, which is now D?
Yeah.
Provide
Provide and improve diagnostic services. Provide and improve diagnostic services. And then,
and screenings or separate?
no, because I think we're now dealing with the screening up in A.
Okay.
Yeah. And then I think we should have one that, well, it says ensures timely treatment and I think we should say and access to other needed services.
I agree.
Ensure timely access.
Okay.
Okay, so let's leave that for right now. So now we're into, you folks who have done some research on this, looking to, Eric and Brenda. Do you find in other states that they're publishing lists of, publicly accessible research for other healthcare providers?
I did not dig that deep.
Okay,
And
How about you,
I'm
Brenda?
getting hold of a professional right now and sending them a copy to help me.
uh-huh,
So I'll give you an answer when I get an answer.
okay,
I noticed, looking at the national site, that was one of their goals, is to have state organizations do just this kind of thing.
yeah.
So not, I don't know whether it's happening, but it's one of the nationals stated goals.
To me, it feels like it should be a national thing. I don't know.
Mhm.
I'm just not sure exactly what the little state of Vermont
Right.
is going to do. It seems a little bit above the capacity of an advisory organization to me. You know what I'm saying?
Yeah, absolutely, I agree.
Um,
It seems more like.
Gotta be realistic.
yeah. For me, I'm in favor of taking number 4 out, but I'm open to other ideas about number 4.
I think it's really ambitious to like expect a new advisory committee to like publish a list of resources that are available, given the breadth of what may be available. But I also do think that there should be some expectation that they're kind of working to identify resources for families and so, you know, publishing a list is a high expectation, but asking them to be a place for families to turn to help them identify resources, which we kind of already, I mean, we talked about earlier in one, like identify what the gaps are for resources and
Yeah, I'm envisioning the gaps or the resources generally as being Vermont specific. This number 4 is broader and seems like Nord, you know, looking at the Nord website, it seems like they've got tons of
I like
information.
let Nord do that is what I was mine.
Yeah.
Yeah, I think they got it covered.
Yeah.
It's like more what we're getting at here is the network sharing of
Right.
information in
Right.
in this community. To make
Well, and I think that this is the first time a website is mentioned, and I think we actually should probably identify that would be one of the things that is doing to establish a website to serve as a resource for individuals impacted. So if we can
so
add
take
that,
out 4 and then add.
we can say
establish
establish a website to serve as a resource for individuals impacted by rare diseases. We don't have to say what's on it.
What line is that?
That's we're deleting number 4, which
Okay,
is on line 12. And then we're putting in its place, establishing a website.
okay. And who does all this? That committee?
The committee would do that, right, with the assistance of whoever we decide it ends up with. So we haven't made that decision yet.
Okay.
I don't think we need to put the review the department's presentation. And I think we need a catch-all categories.
Number 6. That's what you mean.
Yeah. Any other?
Yeah.
I don't know if I would use the word priorities or any other areas or any other,
Wouldn't it be just by the advisory council?
Yeah,
Not the
right.
Department of Health.
yeah,
Any other
activities, any other activities identified by a majority of the advisory council.
That matches in the first line for power and duties to refer to activities.
Right.
For the benefit of individuals.
And assistance, we have to leave open right now because we haven't made a decision about that. And then report, this has an annual report. We're on page 5 now. An annual report to the House committees. Which is a description of what they've done, update of their funding needs. Essentially those two things. I'm hesitant, I'm honestly hesitant to add. An annual report
Me too.
Yeah, right.
for an
I was
advisory
thinking that
council.
just when I saw it, I was like.
Yeah. Since we're talking about, recommendations for legislative actions, we can say a report as needed to these House committees with any recommendations for or with any
Perfect.
recommendations. for-
Yeah,
That's what we need
when
to hear from
we
them.
need to hear from them if they have recommendations.
Yeah.
Exactly.
Yeah,
And we can always ask them to come in and provide testimony to check in.
exactly. So we'd be then eliminating number 1 and 2. We just would have E in it. And I think we should say, whoops, my thing just went, my page just went bonkers. I think we should eliminate the title that says report, just say, legislative recommendations or something like that.
As needed, the advisory council shall submit a written report.
Shall submit any recommendations for legislative action. So this talks about, during the first year of enactment, the council shall meet at least monthly and thereafter by the call of the chair.
We skipped funding. What funding would you need? I thought we were just doing a committee.
The funding that you would need would be for, not, most of them you would not need any funding for. The funding you would need would be most likely for the caregiver, or the individuals with rare diseases. Because they are not, all the rest of the people are there in their job, so they're being paid.
Oh, it would be during work hours.
Right, it would be doing work hours, yeah.
That's covered in G.
Gee, I see.
Well, we're gonna get a fiscal note before.
We will.
Yes,
Yes.
So that tell us.
That would be a pretty low cost.
It's pretty
thing,
minimal,
but
yeah.
We'll have to give up work time in order to participate then.
I do wonder whether, if it's not the Department of Health, but another organization, whether they would be requesting any funding to support the efforts.
Well, we'll find
What
out.
I was thinking, it sounds like a lot of money here to have an admin do all this work. I'm sure the committee's not gonna have time.
Yeah, we'll see what they say. Okay, and so, there's the advisory council shall maintain a
Oh,
webpage.
yes, we can
So,
get rid of it up
On a
there.
webpage.
well, I think it should actually go up
Up
there.
so get-
But you might want to add some of these other things in there.
And then 10, just meetings.
Okay,
Meetings for-
Just a second, I think, the commissioner, I think we should just say that the advisory council shall elect a commissioner, shall elect an individual to serve as chair.
That person.
Where are you?
Now, it's currently number 2, it calls the commissioner of health to be the chair. And I
Okay.
think that the advisory council shall, I hate it when we tell people who their chair should be.
Yeah,
I'm like, let them
yeah,
decide who their chair should be.
right. They can, yeah, exactly. I agree.
Shall elect.
Shall elect an individual to serve as chair.
Is monthly, it feels like a lot to me.
It says only during the first year. I feel like monthly is a lot too, and I was considering, 6 times per year. Or maybe even quarterly.
I was thinking quarterly. I was a little bothered by the vagueness in after the first year at the call of the chair. What do we think about 6 times in the first year and quarterly?
Thereafter.
Thereafter.
It will take some sense for them to sort of get organized, understand what they're going to do. I think it's, I don't like that as determined by the chair. I think,
Well, yeah, quarter, so if it's not taking effect till July 1 and these annual quarterly, are they, I guess their fiscal year, not
yeah, if it,
calendar year.
Yeah.
So, but given that they will need some time to get started, they probably don't need 6 the first year. Quarterly still will work because they won't get started July 1.
right. Why don't we just
Then
say
we don't have
quarterly?
to divvy it up, you know?
We'll make it easy on JFO.
Just-
Yeah, right.
Altogether, just forever, they'll be
Just say
quarterly,
Yeah.
Yeah,
at least quarterly, because if they want to meet more, because they think they have more work, they can do that.
I think that's a good idea. And then G, except for I would say for not more than four meetings. And I think we should delete the last sentence that says these payments shall be made from monies appropriate to the Department of Health. If we think that this is a priority, we should provide the
I
fact.
got a toll violation notice. It's my final notice.
Uh-oh, you better pay it right now, Ann.
On the spot.
What did I just say? Get rid of it?
Yeah, get rid of this.
Just
Yeah.
lit up. Yes.
And then the effective date would be July 1, 2026. We could have it be upon passage, but
So so I understand we don't want it to be appropriated to how will we pay for it? We'll figure that out later.
well, actually, it needs to be appropriated to somebody. So it might be the Department of Health, it might be UVM, it might, yeah.
So there'll come language to that effect.
There will need to be an appropriation because I feel like we need to respect what the Department of Health said that, given their reduction in resources from the federal government, if we want to do this, we need to give them the money to do it. So, yeah, we'll figure out how much that is. So it might not be totally deleting it. And I don't know what UVM is going to say, but we'll find out. You haven't heard from Carol? I'll accost her on the floor. Wait a minute, I didn't say that. Live from House Human Services.
This one might go viral because of that comment.
I know, right? Right. Okay. All right. So I think we've reached a good place with this, and we'll provide this feedback to Katie. She'll send us back another draft, which we'll get to take a look at again, and we'll see where we go from there. So if the vice chair can center the comments, then that would be great. Thank you.
Do that. You're welcome.
Okay, anybody else have anything before you get to have a little bit extra time for lunch today?
Just confirming our schedules will return after the floor or 2:30 for H 248. And then tomorrow, is there anything anticipated in the afternoon?
In the afternoon, there is not anything anticipated. We'll be done by noon. We're going to watch the presentation of Act 115. And then after that would be any questions that people have. Might take a brief look, run through the report section on our webpage, and I might make some assignments about people digging into reports and reporting back to us, because it's difficult for all of us to be able to read all of the reports that come to us, but I think there are some ones here that really are relevant. And then there are also things that we may make recommendations that don't need to be continually reported. So we're going to take a look at that tomorrow, and then we'll be done for tomorrow.
One last thing, Madam Chair, because you and I have been having conversations, S36 is on notice calendar for today, but will be referred to appropriations. And there's also some interesting corrections and also some interest in judiciary.
Yes.
It will not be reported on the floor tomorrow.
It will not be reported on the floor tomorrow. That hopefully will be next week sometime. Yeah.
Exactly. So far, we're up to 3 different.
Yeah.
It might be.
We have interest from 4 committees in total, right? So healthcare took a look. We had it. I did not get any comments from healthcare. I asked them, they did take a look. So healthcare corrections, judiciary, appropriations, our committee, that's 5 actually, so,
Very impressive.
yeah, not bad. Okay, so, and,
One of all that.
Doug and I will be downstairs right after floor, with corrections, to do a brief run through, okay? So, what we will, so just wait for us to come back, I guess. And then we'll start up. If that tends to be, when, I don't know if Janet, I think she'll probably join via Zoom, today, to finish up our discussion about H248 that we got interrupted on yesterday. I don't think that's going to take too long, honestly. And then we'll move to markup on 248. So we'll probably vote out 2 bills next week.
Excellent.
Okay. So, you have any feedback you want to share about what's happening in 91 land downstairs?
The department and administration folks were testifying. I think they like the regional model. There was some talk of, some dissatisfaction with the amount of money. Phrases like we need to spend more on fewer people. So I think, we've heard talk of making all homeless services kind of having eligibility requirements, and that seemed to kind of solidify that might be the angle we get from the department. So,
Some homeless people are worthy of support and others are not.
yes.
Well, that's an interesting approach.
Well, it's
Because
what
it's
we've
kind of-
been, it's consistent with what we've been doing. It doesn't mean it's
But not what we
consistent with
developed.
with
No.
our
With all,
desires.
like,
Yes.
including
Yeah.
HOP and,
Yeah.
so,
Administrative deciphering.
Mhm.
well, and a lot of impact on our communities.
Oh, for sure.
Yeah. All right, well, thank you for your following through and following up with that and following that bill closely downstairs. So
Thank
Um,
you. Julie.
we were just talking about what the afternoon holds. Doug and I will be downstairs in corrections and institutions right after the floor. We are then going to pick up with the rest of the testimony on 248. Tomorrow, we're going to be looking at testimony that was given for Act 115 of 2024. It's a report that was due to a number of committees, and they said, well, will you watch our presentation that we already gave so that we don't have to do it 3 times? And we said, sure. And then we're going to be looking at our reports webpage and making some assignments for people to do that. The other thing I wanted to note, Dan, is I think you had some really good ideas when we were talking with Representative Lawley. And I would love it if you would be willing to take the lead on maybe figuring out some witnesses that we can kind of do some discussion about what would be needed for things like model language for zoning to encourage the development of these continuing care retirement communities.
Yeah.
So I would love it if you could do some background on that and then bring that back for us, and potentially we can take some testimony on that a little bit later this session. That would be great.
Perfect.
Thank you.
Can I ask a question about that? Running through my head this morning during Representative Lawley's testimony in our conversation was a jurisdictional question. Our committee, which seemed very appropriate and enthusiastic response you received, but if it's getting into zoning, when do we?
Oh, it'll go to Amy's committee. It would go to Sheldon's committee, but there's lots of bills, as you can see, who had, your own example, Representative Bishop had interest in this. So, but the concept of, I can tell you that in the Environment Committee, they would not be thinking about how to promote a continuing care community in zoning.
This is trying to, if this bill is going to have further discussion, bring it a little more fully baked to other committees.
We would be giving them the concepts of how to think about these things. And then they would take it and say, well, this doesn't really meet what we do on Act 250, let's just say, or it does, or, you know, maybe we need to change some bits and pieces of it. It's the way all legislation works, if there's
Yeah.
multiple jurisdictions. So, but they wouldn't initiate something like that. So, you know, so the initiation, you know, if that's kind of really the question, the initiation, because the need for residential services and supportive services for older Vermonters is something that is, you know, we've identified that time and time again here. And you know, Dan has said, I can't even count the number of times. If they had a place that they felt comfortable with, they would have no problem selling their house and, you know, moving there. And one of the things I want to really figure out how we tackle is how we do this for rural communities.
Yeah.
Because I don't think it should just be in towns like Waterbury or Colchester or Burlington or Barry, you know, that have municipal services. I mean, I can see on a smaller version, you know, people in Lamoille County might, you know, you might not be able to do it in Wolcott or in, you know, Eden or something, but.
Or could you, because the scale is so much smaller. you
Right.
know, Could you look at 6 units?
Right.
Because 6
Mhm.
units meet the needs of the community.
Right,
You know,
right,
in the short term, so.
yeah,
We've been through oh gosh, what I'm blanking on the organization, the rural,
Rural caucus,
no,
I
rural.
mean, the development.
Yes, yeah, I can't think of the exact, yes.
Council on Rural
Yeah,
Development.
yeah, we did a grant, our town did one of those community planning where you find like, it's two of the two priorities we settled on was like looking at housing. And then the other was kind of like community engagement and building community. And I've been part of the housing task force, making it more affordable, bringing in, and so we randomly have like this possible plot of land that's popped up where the owner is willing. And so that's, you know, we've been having a lot of cool conversations about what the possibilities are. And so I think, and I know this is also happening in other communities. So having
yeah.
this kind of stuff ready to go and here's some resources.
Ready to do it,
Yeah,
yeah.
yeah.
I know that a number of towns are undergoing reviews of their town plans.
Town plan
and,
that we're also doing.
you know, so this could be something that could be helpful to other towns. I mean, it's an option. I mean, just putting it out there as a resource, not saying you have to do it, but
Exactly.
I know in my community, we literally do have a plot of land that they're, you know, going to develop for housing if we can ever sign the deal with the state. But I know for a fact that they haven't been thinking about, well, what about older Vermonters? Maybe we could do a mixed use kind of housing there. I don't know. I'll bring that back as an idea.
Or what I've been talking in my own town is when you do multi-unit approvals, make sure that they have a few that are affordable housing,
Yeah,
a few affordable units.
yeah.
And that's what I've been bringing up in my town. And if they did that in every town and these multi-units, because we're developing our new downtown core, and I said, when we approve these, it should be a requirement. So many units that are affordable.
It is for the publicly developed ones, you know, like things that are done through the housing trust and stuff like that, but the ones that are done by private developers are not. And I think it's an
And
excellent
have a
idea.
carrot,
Yeah,
give them, help them with something.
yeah.
To give them, that's what I'm saying, give them a carrot and say, if we help you with the engineering, or we help you with this, will you do
Or like Dan says, you get
So many-
extra points in your zoning permit
Yes,
if you include
something?
older Vermonters or
Something.
people with disabilities.
Right.
Part of the carrot is Act 250 exemption when it's.
Yes. That's it, that's my carrot.
Mhm.
Yeah, but I mean, there's still.
No, but the Act 250 is.
Yeah, I mean, there's-
biggie.
There's always barriers, and I look at those as opportunities to overcome.
Yes.
Oh, yeah.
Yeah.
Every day.